Aspirin capsule, extended release 24 hours is a low dose of aspirin that is used to reduce the risk of heart attack in people with heart disease and to lower the risk of stroke in those who have previously experienced a stroke or mini-stroke, transient ischemic attack. It is a type of salicylate and a nonsteroidal anti-inflammatory drug, NSAID, that works by preventing platelets from clumping together and forming blood clots that can lead to a heart attack or stroke. It is important to note that this medication is a long-acting form of aspirin and does not provide immediate relief. For fast-acting effects, other forms of aspirin, immediate release, should be used, such as after a heart attack or for pain relief. The recommended daily dosage and optimal timing for taking this medication should be discussed with a healthcare professional. When taking the aspirin capsule, extended release 24 hours, it's important to follow your doctor's instructions and take it once a day, swallowing the whole capsule with a full glass of water unless directed otherwise. Avoid cutting, crushing, or chewing the capsules to prevent releasing all of the drug at once, which can increase the risk of side effects. If you experience stomach upset, taking the medication with food or milk may help. It's important not to lie down for at least 10 minutes after taking the medication, and to avoid taking it 2 hours before or 1 hour after drinking alcoholic beverages. If you also use NSAIDs like ibuprofen or naproxen, it's recommended to take them at least 8 hours before or 2 to 4 hours after taking the aspirin capsule to prevent any interactions. Taking the medication regularly at the same time each day will help you get the most benefit from it. Be sure to follow your doctor's instructions for the best results. If you experience upset stomach or heartburn while taking this medication, it's important to let your doctor or pharmacist know. It's also important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, it's still important to be aware of potential serious side effects, such as easy bruising or bleeding, loss of appetite, dark urine, or signs of kidney problems. This medication may rarely cause serious bleeding from the stomach or intestines, so be sure to seek medical attention if you experience stomach pain, black stools, or vomit that looks like coffee grounds. While rare, a serious allergic reaction to this drug is possible, so seek medical help immediately if you experience symptoms such as fever, rash, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other unusual effects. Before taking aspirin capsule, extended release 24 hours, it's important to talk to your doctor or pharmacist about any allergies you may have to aspirin, other salicylates, or NSAIDs. You should also let them know about your medical history, especially if you have conditions such as asthma, bleeding disorders, kidney or liver disease, stomach problems, growths in the nose, or if you consume alcohol and tobacco regularly. It's also important to avoid taking aspirin if you are a child or teenager with chickenpox, flu, or any undiagnosed illness, or if you have recently received a vaccine. Additionally, older adults should be cautious about potential side effects of stomach and intestinal bleeding and ulcers. For pregnant women, it's not recommended to use aspirin to treat pain or fever during pregnancy, especially from 20 weeks until delivery. If prescribed by a doctor, low-dose aspirin may be used for certain conditions, but it's important to discuss the benefits and risks with your healthcare provider. Lastly, if you are breastfeeding, it's important to consult with your doctor before using aspirin capsule, extended release 24 hours, as it can pass into breast milk and potentially harm a nursing infant. It's important to be aware of any potential drug interactions with aspirin capsule, extended release 24 hours. Some products that may interact with this drug include mifepristone, other drugs that can cause bleeding/bruising, corticosteroids, and ginkgo biloba. It's crucial to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that are similar to this medication. Daily use of NSAIDs may decrease aspirin's ability to prevent heart attack/stroke, so it's best to consult with your doctor or pharmacist for details. Additionally, this medication may interfere with certain lab tests, so make sure all your doctors and lab personnel are aware that you are using this drug. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include ringing in the ears, excessive sweating, and rapid breathing. This medication is not recommended for use during pregnancy. It may harm an unborn baby or cause complications during delivery. Consult your doctor for more details. If you forget to take a dose of this medication, take it as soon as you remember. If it is close to the time for your next dose, just skip the missed dose and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing your aspirin capsule, extended release 24 hours, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a safe place, away from the reach of children and pets. And when it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.